Tonight's lecture is called Stressed Out, Anxious, Ways to Ease Your Mind. It's part of our Speaking of Health lecture series here at Queens. On behalf of Queens, I welcome you. My name is Lisa Sakia. I'm with Corporate Communications here. Okay, now it is my privilege and honor to introduce you to what someone told me was a rock star. One of our volunteers insisted on coming here. She couldn't wait to sign up for this to help out because Dr. Carlton is a rock star. So Dr. Barry Carlton, I'll give you the more professional description of him. He is a psychiatrist. He is also Queen's Chief of Psychiatry here. He is the Director of Medical Education and Patient Care for the Kekela Adult Inpatient Unit and the Family Treatment Center Inpatient Child and Adolescent Inpatient Unit. He received his medical degree from the SUNY Downstate College of Medicine. He completed his training in psychiatry at the University of Michigan. Since being in Hawaii, he has served as the superintendent and clinical director of the Hawaii State Hospital and has attended psychiatric patients here at Queens. He is a full professor of psychiatry at the University of Hawaii John A. Burns School of Medicine. Nationally, he serves as on the Maintenance of Certification Committee for the American Board of Psychiatry and Neurology. And earlier this year, Queens honored Dr. Carlton as the 2016 Kekauka Po'okela Outstanding Physician of the Year. He won the award for Outstanding Community-Based Physician. And this award recognizes Queens physicians who exemplify high-quality care, professional conduct, and outstanding contributions to the medical field, all while serving with aloha. Please join me in welcoming Dr. Barry Carlton.
I'd like to thank everyone for coming, especially with the anticipatory anxiety of the traffic and Obama's presence, as well as the rain and the storm. And we're going to talk about stress and anxiety. How do they differ and how are they the same? Why is it important to have this discussion? Stress is ubiquitous. It's something that we all experience. It's part of life. How we manage stress is different, and different people will experience the same problems with different levels of stress, and that's based on something known as temperament. And we all have different temperaments. I, for example, am quite irritable, high-strung, and at times can get very angry and unpleasant. Whereas my assistant who helped with the presentation is even-tempered, pleasant, agreeable, never raises her voice, and has a smooth and even temperament, so we balance one another out. More importantly, the prevalence of the anxiety illnesses is about 20% of the population, which means that at any one time in Hawaii, there are about 300,000 people that suffer from a problem with anxiety and at times and/or depression. The two problems tend to run together, although this evening will be focused on anxiety. The treatment of psychiatric illness has been important here at Queens since the founding. The founders did, when the hospital was established, establish a psychiatric unit and a psychiatric service. And the current psychiatric pavilion, Kekela, is named after Queen Emma's Hanai mother, who suffered from anxiety and depression. And for those members who are participating this evening who happen to be part Hawaiian, the Indigenous Hawaiian Research Group studied the prevalence of the illnesses in Hawaii, and there is a higher than expected prevalence of anxiety in the part Hawaiian population. whether or not that's an illness-based or, interestingly, is culturally based. That is, the inability to practice traditional culture for people of a particular culture can create in and of itself an anxiety illness or an anxiety difficulty. So it is a really very important subject. And again, most of us experience anxiety at one time or another. What is it that I hope to accomplish? I would like us to be able to, by the end of the evening, know what is stress, how is it different from anxiety, how can stress and anxiety impact your health, what can be done, and when should someone decide I shouldn't handle this on my own? When do I need to seek some sort of help? Stress is universal and common. Most of us have experienced stress in one form or another. For example, deadlines at work, family conflict, an important decision, financial stresses. For myself at the moment, it's trying to decide about retirement, which my children say I should do, which I say I should not. Because I don't know what I would do with myself, and that would be a stress in and of itself, is not knowing what to do with myself would drive me nuts. It can be experienced as chest constriction. It can be experienced that it will never end, that it will always be in a constant state of stress. It also can be experienced as a feeling of kind of not so much dis-ease as illness, but unrest. I can never be comfortable. I can't be particularly happy. There's always something not quite right. Can be experienced as a dry throat, tense muscles, and the increased blood flow throughout the body can cause some people to look paler while others flush. So stress itself is caused by something that can usually be identified, as I'll talk about in a little bit, but then it does create a variety of hormonal and thought responses that in and of itself can keep the stress going unless it kind of gets dealt with. All of the things that cause stress. I have to apologize. I am not a terribly humorous speaker. So I will apologize in advance. It's one of my failings as a speaker. The same way my failings as a father was I never really reinforced positive behavior. I never said good job. But I was lucky. The kids had a mother who said good job, so I didn't have to worry about the stress of their growing up. Their mother took care of it. It is adaptive, actually. When you stop and think about it, if you didn't experience stress, why would you bother to do some things? You know, stress is a negatively valenced word. We view it as a negative event. But it's also motivation. So, for example, when I was younger and more fit and I played tennis, if I played tennis with somebody who I could never return a serve from, that was stressful, and I would give up and walk off. If I could always return the serve, I got no better, so there was no change. If the person was better than I, but once in a while I could return the serve or win a set or two, then I improved. So stress in that sense is adaptive. Stress should also, it's adaptive, it should tell you that something needs to change. For example, recently I've been more irritable than I should be. I'm not a nice person when I'm irritable. And it's not good for psychiatrists to be irritable. We're supposed to be even-tempered. Well, I had become irritable. It told me that I'm doing much too much. So therefore, I need to find other people to do what I am doing, or I have to learn to say no. And I'm the example of, if you want something done, give it to the busiest person you know. And that's me. And that's not a good way to be. So it is, however, a natural physical and mental reaction to both good and bad experiences. hormones are released, and these will increase your heart rate and your breathing rate. And this actually is consistent with the fight or flight response. It tells you that something is wrong, do something about it. Now, there's some positive things that happen. If your heart rate goes up and you breathe faster, well, your brain gets more oxygen, and that's a good thing. Because if your brain gets more oxygen, that helps you to respond to a problem, and it helps clarify your thinking. However, in the brain, the hypothalamus then tells your adrenal glands to release adrenaline and cortisol, part of the flight and fight response. And again, that can be a good thing, but not necessarily. So, for example, the cortisol secretion and the adrenaline secretion will increase your heart rate and your blood pressure. That's what does it. But at the same time, it will cause the liver to release glucose. Well, that's not a big deal. For me, anyway, my hemoglobin A1C is 5.2, which is a good number. If, however, I had diabetes, it would not be a good thing, because then the increase in glucose released from the liver would mess up my diabetic control and would mean I should change my diet, and it would mean that I would be creating a health risk. If you have chronic stress and experience stress all of the time, regularly, without relief, most of us, or at least for me, will experience stress pretty much throughout the day. It's always something that goes wrong. If I don't relax, then it stays wrong. As I've gotten older, what's happened is when I go home, I kind of go poof and manage the stress by kind of being a slug. And I need to make some effort to manage the stress a little bit more productively. But chronic stress can cause problems with the cardiovascular system, high blood pressure, chest pain, and an increased risk of stroke or myocardial infarction. Ultimately, chronic stress will shift over and change the brain and create the anxiety illnesses. There are transmitters in the brain. The main inhibitory transmitter or excitatory transmitter is called GABA, gamma-aminobutyric acid. And in chronic stress, the anxiety transmitters amp up, and your brain experiences the anxiety. If those receptors don't go back down, then your brain is kind of like chronically being stressed, and ever more simpler stresses will create a much more exaggerated response, which will then shift from stress into an anxiety disorder. I use the example here of panic disorder because that's the one that is the anxiety illness that in a funny way is most like stress. Health problems from chronic anxiety and stress, it can cause difficulty with the respiratory system and can exacerbate asthma or emphysema. It can cause problems with falling asleep. This has become a very important part of medicine in terms of adequate sleep. For the house officers, residents and fellows, we have to have something called fatigue mitigation. Why do we have fatigue mitigation? Fancy word for saying make sure they get enough sleep. It's because of Libby Zion. Libby Zion went to now the Weill Cornell Medical Center in New York when she was on a particular medicine, actually something known as a monoamine oxidase inhibitor. And she was in pain, and a sleepy intern didn't realize that she was on a monoamine oxidase inhibitor. He gave her some Demerol, and there's a very dangerous reaction with the Demerol, and she died. So it happened that her father was a New York Times reporter. So he then went after, became concerned about work hours that physicians do, and fatigue, and what happens when they're fatigued. And that led to a series of studies about what happens when people are tired. They didn't read EKGs properly. This was in the era before the computers read them, and then or were reread by another person currently. And so they made medical errors, and that led to fatigue mitigation. So for all of us, we do require sleep. And if we don't get it. And if the stress keeps us awake, well, we'll be sleepy the next day, so we'll become more stressed, and we'll also become more irritable. So sleep hygiene becomes a very important problem with stress. Chronic anxiety can weaken the immune system, increased risk of viral infections, flus, colds, and increased time of recovery. Can also cause changes in how food is metabolized and contributes to ulcers. So the problem is universal. We all experience it. It is common. And we all have difficulties in terms of describing how we are feeling. I, for example, how's everything? Fine. How's everything? My children are happy. I never quite say how I'm feeling. Sometimes I'll say old, which means doing too much. But it is very difficult to quantify stress and to describe levels of stress. Often we exaggerate the things that we feel and describe them as more intense feelings than they really are. Or some of us deny that we're feeling anything, and our mind works to prevent us from experiencing anything as being wrong. And we call that psychiatry denial. That is the way the mind works to prevent somebody from remembering or feeling. So again, the stress is difficult to quantify. Temperament will change how each person will experience the same event. For example, if I had to sit in traffic for Obama, I would go nuts. Even though I have a radio in the car and I could calmly listen to tunes, the idea that I was sitting there would drive me crazy. Other people, perfectly fine. Oh, I'm in a comfortable automobile. I have the tunes going. What more do I need? And I can just sit there and relax. That's temperament. Stress is experienced differently by different people. And there's also are some cultural differences in how stress or anxiety is experienced. So it can be experienced as dizziness, general aches and pains, bruxism or grinding teeth. Dentists can often tell that. That's what my dentist told me. You need a bite guard because you're ruining your teeth because you're grinding them down at night. Indigestion or acid reflux, increase in or loss of appetite, muscle tension in the face or shoulders, headache. The largest single cause of headache and the costs of millions of healthcare dollars are basically tension headaches. Sometimes as migraine, but predominantly tension headaches. Sleep difficulties, as I mentioned, increased heart rate, a cold and sweaty palm, being tired and exhausted, a shaking feeling, weight loss, something I could use. That would not be a stressful thing. That would be a beneficial thing. An upset stomach, diarrhea and nausea, sexual problems. We often don't talk about that, and it's important. Freud dined out on sexual problems. Surprising how rarely psychiatry now asks about marital relations or intimate relations. We've become inhibited again. But actually, it is a good read on stress management in terms of the quality of your intimate relationships. And being irritable, impatient, or forgetful. I am rarely forgetful. I can be very impatient, and I can get quite irritable. And if I'm not careful, I will start yelling. So therefore, I have to know when the stress is reaching the point that I'm going to start yelling, because I have to do something about it and either walk away or change what I'm doing. Otherwise, it will be very unpleasant. So how is it different from anxiety? It has physical symptoms in common, an increase in heart rate. It can trigger rapid breathing, and it can cause muscle tension. Now, when these things come together, increase in heart rate, rapid breathing, you then add in a feeling that you're going to die, this then becomes a panic attack. And this then moves from stress and normative anxiety into something that is illness. So if you have multiple panic attacks, that's anxiety kind of gone crazy. So the symptoms of a panic attack are a headache, hot flashes, chest pain, fear that you're going to die, difficulty breathing, rapid heart rate, and chills. So as you can see, it's not all that different from stress. So there is considerable overlap. The biggest difference is with stress, you are aware of what you are worrying about. So when my children were younger, I worried where they would go to college. Then I worried about how I would pay for it. Then when they went to medical school, I still worried about how I would pay for it. And when the other one went to law school, he got a free ride, so my stress went down a lot. But then I had to pay for a wedding. And when my work stress, I can predict it. There are phone calls I should have made, but I didn't. There are word that's in my mind is performance. I should apologize for that. There are presentations I need to do, but I delayed getting them done. So they're kind of predictable. I know what I'm worried about. With anxiety, you become less aware of what you are anxious about at any particular moment, and the reaction is the problem. It's the feeling of your heart being fast. It's the feeling of not being able to breathe, the fear that you're going to die. Said differently, you worry about worrying. You start to feel anxious about being anxious. And we actually call that anticipatory anxiety. And under certain circumstances, even if the circumstance hasn't happened, people then can begin to worry about what is going to happen, and they then become very fearful and very avoidant. That's what leads, by the way, to agoraphobia. What leads to agoraphobia, which is fear of open places from the Greek, it means that by accident, a person has an attack of panic. They're walking down the street. They can't identify why. Then they have another one, and they can't identify why. Then they become fearful, anticipatory anxiety of walking out of their home or out of their apartment, and then they become housebound because they become fearful of the anxiety. So they worry about being worried. They don't want the panic attack to occur again. And so you can become fearful about events like public speaking, activities like if you're a kid talking in front of a classroom or doing a presentation, social situations, dating, asking somebody out, or being in a crowded room and kind of feeling alone, being alone in a crowd. Phobias about snakes and spiders, which I guess you can avoid. Can't avoid centipedes, though. You're stuck with them. But you can be phobious about things. And recall of traumatic events can all cause terror and panic. Freud felt that the mind was organized by feelings. So in the present, when you have a stressful event, you should hopefully try to focus on the present. These are the things that are worrying me now. These are the things that I can change. However, when it tips over into an illness like post-traumatic stress disorder, you worry about something in the present that is rational. I didn't get to work on time. I disappointed my spouse or this or that. I had some problem at work. However, your mind plays a trick on you. Instead of keeping it in the present, you begin to focus on bad things that have happened in the past. So your mind quickly takes the anxiety in the present and moves it to thoughts about something bad that happened to you, being a victim of abuse or a victim of sexual trauma or wartime things. And that's actually post-traumatic stress disorder. And so, therefore, people will try to avoid certain circumstances that will create anxiety so they don't have the bad feelings. They will try to avoid places in which they may have had a panic attack, so their life becomes more constricted, and that's how it becomes an illness. when you can no longer go about your business quietly, that the anxiety and the stress have kind of taken over, and all you become worried about is, how do I keep the anxiety down? It's not about change, it's not about doing something active, it's how do I prevent anxiety? So you're just calming the anxiety, it's just about calming the anxiety. The majority of acute stress comes from external situations. You know what you are dealing with. Now, sometimes we have to deal with an awful lot. Changes in our families, changes at work, for the people who work with me, a nasty boss perhaps, things like that. And you know what you're dealing with. You have to prioritize what needs to be dealt with. Try to pick on things to do in the present that are doable, where you can have some successes. If you try to do everything all at once, you are probably doomed to failure. And you also have to be able to accept there are certain things you cannot solve. There are certain circumstances you have no control over, certain things you have no control over. Try, if you can, to not so much put it out of your mind, but realize, figure out what you can do and what you cannot do. If you keep trying to do something that you cannot do, like, you will drive yourself batty. For example, there was discussion this morning, why do we have to close all of the roads for President Obama? Why do I have to not be able to go home? Because President Obama has decided to go to Manoa. Well, you can't do a thing about that. So you either accept it or you leave early. And again, I want to appreciate everybody who came and braved the risk of his motorcades going back and forth, because you can't do a thing about it. Stress is often characterized by frustration and nervousness. Anxiety is often characterized by fear, worry, and unease. And there, as mentioned, is considerable overlap. Oh my God, I forgot I had children. So the anxiety, like most feeling states, are brain illnesses and brain problems that are expressed in words and behavior. For example, in the middle of the brain, there's something known as the limbic system. The amygdala is in the middle of the brain, and it plays a role in phobias and other illnesses that involve specific fears. It changes. For example, in depression and anxiety, it shrinks. If you treat the depression and anxiety with medicines or other biological means, or cognitive and behavioral therapy, changing the way you think, the amygdala comes back to its normal size. The hippocampus is another part of the brain. It's supposed to look like a seahorse. I never saw that. And it helps modulate memory. And it gets reduced in size in traumatic disorders. And this is why people with traumatic disorders have flashbacks and fragmentary memories of the traumatic event, because the hippocampus is not working properly. So when it experiences anxiety, it can't create a complete memory. It can only create a part memory. And that's what is thrust into awareness. And there are the amygdala, with post-traumatic stress disorder and panic, connects to different nuclei, parts of the brain in the brainstem, and these control respiration and heart rate. So when you have an overwhelming amount of anxiety, this part of the brain is signaling another part of your brain to work overtime to increase your heart rate, increase blood pressure. This, by the way, leads to a biological intervention that is used in PTSD to decrease arousal. You can cut off the anxiety response in a couple of ways, with changing thoughts. Mindfulness, we'll see in a little bit. There are a couple of things that you can do actively, but you can also short-circuit it with medicines, and one of them is prazosin, which decreases arousal and it prevents the spread of the stimulus from the amygdala into the brainstem. So, now we're going to begin a little bit. Benzodiazepines, alcohol, and opiates make this part of the brain, that means the parts of the brain that control feelings and thought, less active, and consequently their effect is temporarily reducing anxiety. So it is probably true for some people a single glass of wine may be anxiety reducing. However, tolerance very quickly develops, so it's not an effective technique. You wind up needing more and more to have the same effect, to eventually you don't have the effect any longer because you can't take enough of this stuff to calm you down. The central gray nuclei are involved in an involuntary component of body movements, as well as obsessive compulsive disorder, which is an involuntary thought anxiety disorder. It's experienced as anxiety, and an involuntary movement, the compulsion, what you do to get rid of the problematic thought. So again, these are all brain illnesses. The prefrontal cortex plays a significant role as modifying emotions. That's up here, is the part of the brain that controls emotion, thought, executive functioning. It also, by the way, is involved in depression and is part of effective therapies for anxiety, which are called the exposure therapies, which I'll explain in a little bit. So how to manage stress. Figure out what you can do about sources of stress. Think through the pros and cons of actions and take actions one at a time. Maintain a positive, realistic attitude. Accept that although you can't control certain things, you are in charge of how you respond. I apologize for saying things multiply. I was taught when I was a teacher at one point that all textbooks repeat the same thing 3 times, got to overlearn. Then when I went to psychoanalytic school, I was taught the same thing. You don't interpret anything until you've heard it 3 times. So you're going to hear a lot of the same stuff 3 times, overlearning. So therefore you wouldn't have to bother going to Facebook and social media to listen to what I said, because you will have remembered it. It's important to stand up for yourself in a polite way. Share your feelings, opinions, or beliefs, and do this instead of becoming angry, defensive, or passive. And do it as I statements. I feel, I think. This has made me. Try to avoid criticizing. I statements describes how you feel, and you stand up for yourself. May not change anything, but at least you can feel that you're effective in social interactions, and that becomes very important. And at times, parts of the cultures here in the islands are not particularly assertive with this. We don't speak up. So there are certain cultures where it's considered rude or inconsiderate to speak up. If that's part of your culture, that's fine. But then if you don't have the rest of the culture to help reduce the stress, it's not going to help. They'll just get kind of walled up inside. Learn and practice relaxation techniques, progressive muscle relaxation, breathing exercises, meditation, prayer, yoga, or Tai Chi. This is going to sound like a TV commercial. Exercise regularly. We all should. How many of us really do? Some of us even pretend to do it, but how much of us really do? Attempt to eat properly. Yeah, sure, another thing. But we all do need to eat foods that help us reduce stress and tension, and they really do. There are certain foods, milk products, for example, release tyramine, and that causes a sedating feeling that makes it easier to go to sleep. I happen to like macaroni and cheese. It's horrible for you. because it's actually associated with a positive memory. It has nothing to do with the food. It's associated with something with a positive memory from childhood. But you can't eat it all the time. Say no if you can to things that would add more stress to your life. Something that we don't think about enough, having fun. I always advise students when they're talking about working all of the time and how much they're studying, well, did you take a break? And what did you do for fun? Because if you have some fun, you will study more efficiently. If you don't have fun, you'll just fall asleep. I actually read mystery stories. I mean, I managed fun through medical school. My wife always thought I was studying. I actually have Sherlock Holmes memorized because I spent a lot of time reading Sherlock Holmes. Get enough rest and sleep. Again, don't rely upon alcohol, drugs, or food to help fight stress. Try to limit your caffeine use. Advice I don't follow. This is probably the most important. Spend time with people you care about and hopefully who care about you. Nourish your relationships, nourish your friendships, and even as things change, keep nourishing your friendships and nourishing what would be called in 12-step language, and I'm not in recovery or in alcoholic affiliations. The most important part, for example, of a 12-step treatment for alcohol use is maintaining affiliations. Temporary fun, going to Vegas, alcohol, gambling, spending too much money. Well, it'll help briefly, but it'll only create more stress because you've got to pay the bills. I just came back from New York. I spent far too much money waiting for the bills. Now, progressive muscle relaxation. This is it's a two-step process where you systematically tense particular muscle groups in the body, such as the neck and shoulders, then release the tension. You notice how your muscles feel when you relax, and this helps to lower tension. It sounds easy, it's hard to do. I'm going to zip through these because I have some YouTube videos that say it better. Try to tense only one muscle group at a time. The way this reads, and if you happen to look at the PowerPoint, I did it from the bottom up, and the YouTube video goes from the top down. It doesn't really matter. It's what you're most comfortable with. I find it easier to tell people about curling up your toes and doing things from the bottom up because it's something that you're more used to.
This program is brought to you by Emory University.
I stole it.
Welcome to Take 5, sponsored by the Emory Faculty Staff Assistance Program. I'm Diane, and during our time together, I will share with you quick and easy strategies for managing your stress with an activity called progressive muscle relaxation. Progressive muscle relaxation is an exercise that relaxes your mind and body by progressively tensing and then relaxing targeted muscle groups throughout your entire body. You will tense a muscle for about 5 seconds vigorously, but without straining, and then suddenly release the tension, feeling your muscle relax. You can complete these activities almost anywhere at any time, so even if you only have a few moments, you'll still benefit from those moments of self-care. If you feel any pain or discomfort in any of the targeted muscles throughout any of this exercise, please feel free to skip that step. It is important to be mindful of your own limitations and stop if necessary. Throughout this exercise, you may want to envision the muscles actually tensing and then a wave of relaxation flowing over those muscles as you release that tension. It's important to continue breathing steadily throughout the entire exercise. You could turn down the lights, focus on soothing images, or close your eyes. Now let's begin. Start by taking a deep breath and allowing your attention to focus only on your body. If you notice your mind wandering at any point during this exercise, bring it back to the muscle you are working on. Take a deep breath in, hold, and exhale slowly. Take a few more deep breaths in and out. As you exhale, imagine the tension being released and flowing out of your body. And again, inhale and exhale. Feel your body already relaxing. Remember to keep breathing steadily throughout each step. We will start with the upper body by tensing the muscles in your forehead by raising your eyebrows as high as you can. Hold and abruptly release, feeling that tension fall away. Next, tighten your eye muscles by squinting your eyelids tightly shut. Hold and release. Gently pull your head back as if to look at the ceiling. Hold and release, feeling the tension melt away. Now feel the weight of your relaxed head and neck sink forward. Hold and release. Now lift your shoulders up as if they could touch your ears. Hold, then quickly release, feeling their heaviness. Tighten your biceps by bringing clenched fist up to shoulder level and keeping elbows pointed towards the floor. Feel the buildup of tension and hold and release. Now tighten your triceps by extending your arms in front of you and locking your elbows. Hold. Again, feel the tension build up. Then release, relaxing your arms completely. Tense your upper back by pulling your shoulder.
We're going to run out of time, so I'm going to keep moving. And you'll find that in all of these things, the common theme is focusing on the present, focusing on now, and reducing stress, tension, and anxiety by redirecting your thinking and your feelings into the right now, into the present. Deep breathing.
So one of the fastest, easiest, and most effective ways that you can immediately reduce your stress and decrease your anxiety is by learning to take really deep and cleansing breaths. And in order to take these kind of breaths, we need to learn to breathe from our bellies. A lot of us get stuck in our chests and breathe really shallow breaths through our chests. But if you just take a minute and focus on breathing through your belly, and you can even do this by holding your hands right on your belly, and as you breathe in, watch your belly rise as it fills with air, and then when you exhale, watch your belly lower, and watch your hands on your belly lower as you exhale that breath. Now, learning to breathe this way is not easy, and it does take some practice. And you can do this kind of practice by doing an exercise called square breathing, and I'm going to lead you through that square breathing right now. So what it is that we're going to breathe, take 4 counts to breathe in really deeply through our nose, and then we're going to hold that breath for 4 counts, and then exhale through our mouths for 4 counts, and hold the empty lungs for 4 counts. So if you'll join me with right now in doing this, so we'll do inhale through your nose for 4 counts, 2, 3, 4, hold, 2, 3, 4, and exhale through your mouth, 2, 3, 4, and hold, 2, 3, 4. In, 2, 3, 4, and hold, 2, 3, 4. Exhale, 2, 3, 4, and hold, 2, 3, 4. And inhale, 2, 3, 4, and hold, 2, 3, 4. And exhale, 2, 3, 4, and hold, 2, 3, 4. So we just did 4 counts in, and we held for 4, and then we did 4 counts of exhaling and held for 4, and we did that 4 times. You can do this anytime, anywhere. It really only takes a minute, and within that time, you'll notice yourself feeling a lot more calm, a lot more centered, a lot more balanced. You can do this with this video in a guided way, or you can do it on your own, no matter where you are. And regardless of whether or not you even have a minute to do the exercise, always remembering to take really deep belly breaths when you notice yourself feeling.
Tai Chi. It's an ancient Chinese tradition. Practice is the graceful form of exercise. It involves a series of movements performed in a slow, focused manner and accompanied by deep breathing. When learned correctly, it will decrease stress and anxiety, improve mood, improve aerobic capacity, and increase energy and stamina, improves flexibility, balance, and muscle strength and agility. Yoga brings together physical and mental disciplines. It may help achieve peacefulness of body and mind. This helps in managing stress and relaxation. Hatha Yoga, as opposed to Bikram Yoga, which is that hot stuff, may be the preferred form of stress management for beginners. And it's a series of movements designed to increase strength and flexibility. And they can range from lying on the floor while completely relaxed to difficult postures that I can't do. Breathing, controlling your breathing, helps you control your body and quiet your mind. Meditation or relax helps you become more mindful and aware of the present moment without judgment. Yoga, as you'll see, is the combination of all three things: progressive muscle relaxation, deep breathing, and mindfulness. A state of active, open attention on the present, when you are mindful to observe your thoughts and your feelings from a distance. You don't judge them as either good or bad. Instead, you let your life pass you by. Mindful, this means living in the moment and awakening to experience. It's currently kind of trendy. She's back.
So something that often comes up when I'm working with my clients in therapy is the topic of racing thoughts, and the topic of, anxious thoughts, and, and something that someone is worrying about comes up, and then they can't stop thinking about it, and they notice themselves getting more anxious, kind of knotted feeling in their stomach, tightness in their chest, and their brains are racing and going around and round in circles. And it's an uncomfortable feeling, and obviously a really unpleasant experience. And I think all of us have experienced something like that from time to time, some of us more often than others. And something that can be really helpful when something like that comes up, depending on the situation, is something called mindfulness. Now, I'm sure most of you have heard of mindfulness. It's kind of the big thing right now, and it's kind of just a fancy way of saying concentration or focusing. So mindfulness is just sort of another way of talking about, honing the talent of being able to concentrate or really focus on something. So something for you to try. Next time you notice yourself feeling really anxious, really worked up, head is spinning, can't stop thinking, can't kind of calm yourself down. First of all, start with taking a really deep breath. Oxygen in our brains can sometimes do wonders, often do wonders, and sometimes do miracles. But taking a really deep breath and then thinking about the thing that you're feeling anxious about, and then concentrating on something else. Now, something, when we get really anxious and we notice ourselves getting really worked up, we're thinking about oftentimes how things are going to be really terrible. We're anticipating something turning out badly. We're anticipating something, frustrating happening, or we're feeling bad about ourselves or a situation. So the antidote to that is to practice focusing on something that makes you feel good. Focus on and think about what you're grateful for. Something small. It can be as simple as, having a warm, soft bed to jump into that night, or thinking about someone that you love, or someone that makes you feel loved, or a place that you go on vacation, or, for a little break. Somewhere that you go that is your happy place, or somewhere that you really enjoy that brings up a really strong sense of well-being and happiness and calmness, and to just focus on that. and think about that, and think about in detail one of those kind of positive things. And I'm not saying it's going to make the problem that you're dealing with go away, but what it does is it gives our brain a little bit of a break. And you know, there's a lot of brain research and brain science right now that is talking about how the things that we focus on and the things that we think about and the experiences we give ourselves, that is what our brain kind of molds to. And there's this little saying that goes, neurons that fire together wire together. So the things that we actively think about and focus on, those are the neurons that are firing. And the more, for better or worse, so the more negative stuff we think about and focus on, the more kind of wiring of our brain, it becomes sort of anxious and negative and depressed. But if we can start to practice catching ourselves in those spinning thoughts and turning them around and getting, you know, positive or calming or happy or enjoyable kind of neurons firing, then that's what kind of starts to wire together, and eventually, you know, will change dramatically the makeup of our brain.
And just as an aside, my strategy for mindfulness is I plan vacations, which I never take. And then the thing that she was talking about, neurons being wired together, Freud actually attempted to write something about that, and he wrote it something known as the Project for a Scientific Psychology. And he didn't have the science to describe what she just described, but that's basically what he was talking about. So when should someone seek help? It is certainly true if that you have insurmountable problems and you experience yourself as not being able to solve them. This is where employee assistance programs, this is where counseling, perhaps non-medical, comes into it. I've put up what primary care physicians use as screening, and it's called the General Anxiety Disorder Scale number 7, because it has 7 characteristics to it. So, over the last 2 weeks, how often have you been bothered by the following problems? Feeling nervous, anxious, or on edge, not being able to control or stop worrying too much about different things, having trouble relaxing, being so restless that it's hard to sit still, becoming easily annoyed or irritable, and feeling afraid as if something awful might happen. So you rate each of those on the following scale. 0, nah. 1, maybe several days. 2 is over half the days. 3 is nearly every day. Then add up all the columns for a total score. And for each of them, decide how difficult it has been for you to do things, get along with other people, or do your things at home. This, by the way, is in the psychiatric nomenclature, defines illness. That is, if you can't do these things, you're moving away from health and into illness. Is it not at all difficult, somewhat difficult, very difficult, or extremely difficult? And 0 to 7, no anxiety. 8 or above, possible anxiety. And where to go for help? Initially to your primary care physician to ensure that what you are experiencing is stress or anxiety and not something else. There are some medical illnesses, thyroid illness being one, adrenal illnesses being another, that masquerade as anxiety. If it is stress or anxiety, they can refer to Queens. They can refer to our counseling service. And then the therapies. There are medicines. The selective serotonin reuptake inhibitors are the so-called, those are things that you've heard of, Prozac, Zoloft, those little happy people on your television screen. And they actually are both antidepressants and anti-anxiety. And they are safe with few known permanent long-term side effects. And they manage anxiety. The benzodiazepines, Ativan, Valium, Xanax, good for short-term management of anxiety, but horrible for long-term management because they create tolerance. If you suddenly stop them, you can have seizures, and inevitably there's a dosage escalation. So there are some, they are worthwhile for short-term treatment, but not for long-term treatment. The antihistamines, things like Benadryl, they will help you go to sleep. And then, as I mentioned earlier, the alpha-adrenergic, that really is getting into things like post-traumatic stress disorder, and the psychotherapies. The exposure therapies, that is, if you're afraid to go to school if you're a child, well, you have a lot of anxiety, you're afraid to go to school. Well, you find, and there's nothing wrong with school, you haven't been beaten up, you're not in a traumatic event. The exposure therapy would be to work with somebody whom you know cares about you, who is not going to get anxious, and gradually set up a pattern of over a week or two to get back to school. The cognitive and behavioral therapies can't control our feelings. We can control our behaviors and we can control our thoughts. So if you have a particular feeling, recognize the feeling, then figure out what is the automatic thought, see if that thought can be changed. What is the negative behavior that goes with that feeling, see if that behavior can be changed, and change it to something positive. For those of you who remember the book or who read it to your children, The Little Engine That Could, I think I can, I think I can, I know I can, I know I can. That's the cognitive and behavioral therapies. And then the supportive therapies are education and a variety of other techniques to help decrease anxiety. And I'd like to thank you for all listening. You were a very good audience. I'm sorry I took a little bit too long. I apologize for that.
We can still open it up for a couple questions.
Any questions?
Please raise your hand.
Is there a genetic component to this if it's brain-based, these stress and anxieties?
Yes, there is. The simple answer to that is yes. It hasn't been well worked out. There are both ethnic groups where, as I mentioned earlier, we have an overrepresentation of the anxiety illnesses. There is some temperament issues that has to do with culture, and the interaction between how people get along together is an interactional problem. But yes, there's definitely a genetic bias. There also is some sex differentiation between men and women. Women are more vulnerable to anxiety illnesses and depression having to do with hormonal issues and hormonal changes and the changes in estrogen and progesterone and the relative balance between the two, as well as other kind of arcane factors, but there are real, there are sexual differences and genetic differences. Good question, thank you.
Thank you very much for a very interesting lecture. Doctor, you talked about different methods and effective things, techniques to get out of some of the anxiety and stress. And of course, that's also preventive in that it doesn't lead to further depths. However, do you have any advice or do you ever address just prevention to begin with to someone that doesn't have it?
The prevention issue is, it's a very good question. It's embedded in the slides about responding to stress. So if you stop and think about it for a moment, healthy lifestyle, limit what you can do, don't take on more than you can do. Most importantly, have fun. And second most importantly, have fun with somebody that you care about and who cares about you. And that probably is the best preventive technique that I can think of.
How does your secretary deal with your irritability and all that? Does she just let you rant for a minute and just leave you alone?
Well, she doesn't criticize, and she's always helpful, and she smiles. I actually am fairly good at self-observing, and so when and I think one of the things that is important to learn about yourself is how stress strikes you. And that's why I gave the exhaustive list as to how stress will strike you, and so that you can self-observe and do it on your own. I've been known to say on Kekela, I'm leaving because if I don't go, I'm going to start yelling. And so my children knew when to leave me alone. And so it's kind of important to know yourself, really.
Yeah, hi. I kind of want your advice. I'm a type A person. I'm also a Virgo who's a perfectionist. And I find myself making endless lists of things to do, like things to do tomorrow, things to buy at the store, shows to watch on TV. I have this, I don't know, you call this fear of forgetting something or missing something or not taking care of, you know what I mean? Got any advice?
Yeah, I do know exactly what you mean. And with the assumption that it doesn't tip over into I can't do things, I get so worried about worrying, that would move it into an anxiety problem, which would be really between you and your primary care doctor. But as long as you're productive and don't get into worrying about worrying, then plan vacations. Guided imagery. The slide I didn't show in terms of mindfulness was somebody describing looking at a leaf. Well, I look at a leaf, and I think I grew up on the East Coast, so they're either green, they're brown, or they're red. And in the description that he had of the leaf, it was very detailed, and it was focusing on every aspect of the leaf, the veining, the shape, drawing the leaf, focusing on something to kind of keep the tension down and get the worrying thoughts out of your mind, at least temporarily. Thank you for a very good question.
Please raise your hand if you have a question. No? Really? Chief of Psychiatry can answer any of your questions. Don't be shy. Don't be anxious. Don't be stressed out about asking. Anyone?
Okay, thank you. Oh,
sorry, just one more, I think. Thanks for bringing up about the benzodiazepines as being short-term use. Do you have recommendations for people that have been kept on them for decades that cannot live without them, but they're not working?
That really is a discussion that's better with either your primary care physician or with a behavioral health professional. There are certain illnesses that are anxiety illnesses, amongst them dependencies on medications, amongst them when anxiety really badly interferes with memory, causing this dissociation that I've left out, people who have suffered from being victims of abuse or trauma of one form or another, which creates a variety of anxiety symptoms. And those are really best left to a consultation with a behavioral health specialist, be they social work, psychology, or psychiatry. In terms of safely withdrawing from the benzodiazepines, if that's the desired amount, the thing that I usually recommend is a very slow taper of no more than 10% per week, or even 10% per month, which will minimize the withdrawal symptoms, but there still is the anxiety left to deal with. So it shouldn't be done kind of in a vacuum. It's quite risky.
Do you think that it's pretty much agreed what you're saying, though, that short-term use is recommended?
I think if short-term use, in my opinion, and according to the FDA, is perfectly safe and reasonable. It's when you get into more than 3 or 4 months, you're going to start running into tolerance issues and dependence issues and risks for seizures if you suddenly stop them. And you've got to remember that for the brain, alcohol and benzodiazepines are the same. So.
Thank you. Okay, we have one last question.
How much of this behavior is learned behavior? Like when we were young, we were exposed to this, and this is the way we learn to deal with anxiety or deal with stress. And how do you address that? How do you determine that?
Well, I am an analyst, so I do believe that a considerable amount of behavior is learned, and it becomes part of our everyday way of managing problems, and we develop patterns Freud had a very simple-minded idea that we develop patterns in our life which we continually repeat. Some of those are adaptive, some of them are not. And psychotherapy is aimed at changing the maladaptive to the adaptive. It is also true, and this is the learned behavior of what I would choose to call, the example I gave earlier was about agoraphobia. That's learned behavior. You leave, you have a random panic attack. You then became afraid of the panic attack. You're then afraid to leave your home because you fear of a panic attack. And that's learned behavior. I, for example, I've had one panic attack in my lifetime. It was about Selma Freiberg, and I was supposed to take her to the airport, and I couldn't find her. And she was a very nasty lady, and was not very nice to residents, and I was a resident at the time. And so whenever I think about her really great book called The Magic Years, I have anticipatory anxiety, and I recall that panic attack. So there is a considerable amount of behavior that is learned. We often describe behaviors as a negative way as attention-seeking. All behavior is attention-seeking. We are all wired, or most of us are wired. I think this went off. Most of us are wired to be involved with others. And so you can either learn to get relationship with others by doing positive things and being positively reinforced by failing as a father, or you can learn you get it by doing negative things, by self-harm behaviors, by temper tantrums and things like that, and then you learn very quickly that that gets attention too. And so most behaviors in one way or another are learned in some way. The anxiety disorders are no different. Again, I'd like to thank you for being an excellent audience. I appreciate your coming, and I'm sorry I went over.